and welcome to our second Masterclass series. We have the incredible Shelley McKenzie, a Clinical Nutritionist and Naturopath, joining us. Just to remind everyone, our Masterclass series is something that we run every fortnight with a different clinical practitioner or educator in the field of women's health. And so we're fully booked out till the end of the year with different practitioners, therapists. It's very exciting. So after this, you'll be sent another link for the following fortnight's expert who's coming on. But yeah, today we have the beautiful Shelley, as I said, clinical naturopath and nutritionist, is going to talk to us about thyroid specifically, and then nutrition, lifestyle, and then talk sort of specifically also to postpartum health. So hi, Shelley, and welcome.
Hi, Steph. Thanks for having me. Glad to be here.
Absolutely. Let's just get straight into it. I think we talk often about thyroid issues, thyroid problems, testing for thyroid. Some people might be thinking, all I've ever heard of is TSH. I think a really good place to start would be, what exactly is our thyroid? What does it do?
Yep.
What's its purpose? Why do we even have one?
Yeah. So I guess our thyroid is it's a butterfly-shaped gland based in the base of our neck. And the simplest way to think about it is that I kind of like to say it's like our powerhouse when it comes to producing hormones, and then, regulating the body's metabolic rate, growth, and development. So it controls things like our digestive function, brain function, bone maintenance. It's super important. And when it goes obviously out of balance, a whole heap of symptoms and things can come at play, which I'm sure we'll dive into. But yeah, that's basically what it is, I guess, in a very quick version.
So does the thyroid have anything to do with like our estrogen and progesterone? Is that related as a hormone, or?
So it's more our T3, T4, TSH, which we'll talk about. It's not necessarily our like estrogen, testosterone, those female hormones. However, when our thyroid is out of balance, let's just say, it can cause issues to other hormones, such as our women's reproductive hormones. And it's not uncommon for menstrual cycle irregularities to occur when the thyroid is out of balance. But no, the key hormones there that I'm talking about is the T3 and T4. And as you mentioned, most people know the TSH because that's commonly what is tested through a GP if they've ever tested your thyroid. But it's our T3 and T4 that are our two major thyroid hormones, and these work together to regulate your body and the way that your body uses energy, which then impacts things like our metabolism, menstrual cycle, heart rate, body temperature, and heaps more. So, yeah.
So if our thyroid levels of the T3, T4 are out of whack, it can have a multitude of effects in terms of feeling exhausted, putting on weight, losing weight. Are they sort of the common things that you'll start to see when they're a bit out of whack?
Yeah, for sure. So I guess if we think about the thyroid, there's two common camps that we can be in. So there's hypothyroidism, which is Hashimoto's is probably the most common. Sorry, there's three camps, I should say, but Hashimoto's falls under hypothyroid. Then you've got hyperthyroidism, which is where Graves' disease falls under. And then you've got postpartum thyroiditis as well. So in terms of symptoms, we've got hypothyroidism, and the best way to think about this is everything's just slower. So your thyroid's not producing enough of those hormones, that T3, T4 hormone. And so with those symptoms, given that everything just runs a little bit slower in the body, you start to experience constipation, weight gain, getting cold is like a really common symptom, especially if it's, say, summer, but you've always got, you always feel really cold and feel like you're quite rugged up. And yeah, it's that slow kind of metabolism. Then you've got hyperthyroidism, which everything runs faster. So this is when your body's producing too much of your T3, T4 hormone. So symptoms with your hyperthyroidism can be irregular heart rate, so quite a rapid heart rate, irritability, diarrhea, sweating, which then can lead into things like sleep disturbances and insomnia. So yeah, everything runs faster. And then your postpartum thyroiditis I commonly see it kind of swing between the hypo, and then it lands mostly in the hypothyroidism camp, and they would be your symptoms you experience, which in the postpartum period can be really hard to, I guess, get picked up unless your thyroid's being tested, because commonly things like fatigue, stubborn weight or weight gain, constipation even, that they can all come with postpartum, obviously. So it is a little bit trickier in that postpartum period to pick it up. But I guess that's why we're here today and what I'll help you work out.
Absolutely. And I'm going to jump back and forth just a little bit because it's relating to what you said. And what I was going to ask was, in order to diagnose, I guess, whether you have postpartum thyroiditis, do you need to know your TSH levels pre-pregnancy, or is it something you can pick up post-birth and you'll know?
Yeah, it's something you can pick up post-birth, but commonly your TSH is tested prior to pregnancy or within your first trimester anyway. So you will most likely have a TSH reading, most likely not a T3, T4, unless that TSH came back irregular, but you will have that reading anyway, no doubt, from your first trimester. Even if you don't have that reading, let's just say, for example, your GP didn't do it, or you went to a different pathology for your next lot of testings in your postpartum period, we can still see that there's an imbalance with your TH based on reference ranges.
Right. Okay. And am I correct in saying this is just through different people I've spoken to and different practitioners, in that when testing your TSH, which stands for thyroid stimulating hormone, is that correct?
Yeah.
That's actually testing your brain's ability to communicate with your thyroid and not actually the levels of your thyroid hormones. Is that correct?
Correct. So TSH, yes, it's how your brain communicates with your thyroid to release the T3, T4. So I guess we personally in the naturopathic world don't see that as an accurate picture as to what your thyroid's doing, because the reference range for your TSH through Western medicine, through a GP, is very broad. From memory, it's 1 to 3, maybe even 1 to 4 is your reference range. Whereas from a naturopathic point of view, we like to see that between 1 and 2. And so obviously our reference range is very different. But unless your TSH comes back irregular and outside of that 1 to 3 or 4 with a GP, they're not then going to go on and test your T3, T4, even though you could be experiencing all of the symptoms.
And I think that's really interesting, because that tends to be the case with a lot of sort of testing and reference ranges in sort of the Western GP world, versus if you go into the naturopathic world and what it just seems to be much more focused and granular when you're going into the naturopathic world. And I think that allows naturopaths and nutritionists to really understand the symptoms that bit better, because I know a lot of women, I'll say women because that's sort of who we're talking to, will go to a GP, have their bloods done and say, my bloods are normal, but I still feel tired. My bloods are normal, but I'm still feeling depleted. So I think that's just a really important piece of information for women to know, that the range is quite large when you go into a GP. You still could be feeling off. I don't know if you can answer this, but as just an individual patient, can you actually say, I want my T3, T4 tested?
Yeah, but often we're doing it through a pathology. The one that I personally use is called iScreen. So we're going around the GP, because it is really hard to continue to advocate for yourself, particularly if you've been told over and over again that your bloods are normal. It just becomes hard to keep on pushing through that barrier. And so going through, say, iScreen and getting your thyroid tested, which would be your TSH, T3, T4, and then thyroid antibodies, which we can talk to shortly. It's $140, I'm going to say, out of pocket, and we get exactly what we need to actually be able to look at where your thyroid's at. Now, the thing with the naturopathic world or, conventional medicine is that we can't diagnose. So what you would then, if you wanted an official diagnosis, you would then need to go to your GP, show them and try to get that diagnosis. However, we can still treat naturopathically based on your results, which is normally what we do. even without the diagnosis, because it's not something that you have to live with forever either, which is a really common misconception when it comes to thyroid health.
And what would be, now I'm jumping again, but what would be the difference between conventional medicine and, say, how a naturopath would treat thyroid issues, whether hyper or thyroiditis or?
Yeah, so I guess it just comes down to whether medication's used or not. So from a naturopathic point of view, we don't use, obviously, your medication. So say in the case of hypothyroidism, so Hashimoto, often thyroxine is the medication that is given. And look, some people, I guess it depends on the I'm going to say the state of your thyroid health and kind of whether this has been actually at play for a really long time, but you haven't been able to get the answers you were looking for. And for some women, I've seen that. And again, it's more prevalent in women. And so I guess that's why we talk to women in this situation too. But I've seen it up to 10 years. When we've actually looked back at blood tests, we can see that the thyroid antibodies were climbing over a 10-year period. So they've experienced symptoms for a really long time. And often in that case, the antibodies have become so high that they're now medicated. And the medication, time and place, right? So some women can feel really good initially on the medication. Some women may start the medication and see no shift within their symptoms. And so this is where I guess then the natural approach comes in, where we look at the diet and lifestyle and supplements we use to really start getting a shift in those thyroid antibodies or thyroid readings so that you can feel, back to your superwoman self. So yeah, did that kind of answer that question?
Yeah, definitely. And I think it tends to always be the way that a general practitioner, so I wouldn't say an integrative GP, but a general practitioner is going to prescribe medication. They're there to give you drugs because that's what they're trained in, that's what they know, and they want to, cure the disease. Whereas obviously from a naturopathic point of view, you're looking at natural ways in which you can support the body. So talk to me about these thyroid antibodies. What are they? What do they do? What does it mean if they're high, low?
Yeah. So thyroid antibodies are essentially where we then see the diagnosis of a thyroid condition versus not. So again, and this is where we'll talk to postpartum thyroiditis, you won't have thyroid antibodies or maybe very low thyroid antibodies if you've got postpartum thyroiditis. And the reason for this is because the thyroid, generally speaking, there's 3 contributing factors to why a thyroid condition comes about, and that is genetics. Then you've got some form of trauma or stress on the body, and so that can be for many women it is pregnancy or giving birth or then menopause. So they're commonly when you'll see it come out in a woman's kind of postpartum journey, I guess. And then you've also got gut dysbiosis, which is a really big one. So there's, more and more studies coming out around SIBO and leaky gut being another contributing factor. So the thyroid antibodies, this is when it is that genetic disposition, I guess. So there's that, I don't know who said it, but it's genetic loads the gun, but then it's our lifestyle and environmental triggers, that pull the trigger. And so if you've got the genetic disposition for it, then you may start to see those antibodies creep. And as I said, they can be creeping for up to 10 years before your TSH, T3, T4 become reflective of that. So I guess that's why these antibodies are really important to get tested, however, quite difficult to get tested through the GP normally. So your thyroid antibodies are going to be where you get your diagnosis of autoimmune disease. With thyroid antibodies, there's a really common misconception that they can't be lowered at all, and that's just simply not true. Thyroxine, which is the medication we spoke about, it does reduce inflammation around the thyroid, so it does shift antibodies slightly. However, when we dive into the diet and lifestyle and supplements, we definitely see a really big decrease in antibodies when we use the right supplements. Once your antibodies are over 1,300, it actually, we no longer have a reading. So the testing stops at 1,300 for your thyroid antibodies. So sometimes from a clinical experience, I'll see women with thyroid antibodies 1,300 somewhere above. And after 3 months, we retest after doing a strict supplement protocol and doing all the dietary, and then they don't see a shift at all in their thyroid antibodies. But that could be because their thyroid antibodies were up in the 2,000s or 3,000s, and we've just got to wait that course for it to come back down. So that's what your thyroid antibodies are. And then I guess the reason you won't see them in your postpartum thyroiditis is because there isn't that genetic disposition. And generally speaking, it is from a hormonal shift that has occurred from either pregnancy and or birth, and normally resolves itself within the first year. However, what I say to women is that even though the antibodies aren't present and your thyroid will most likely revert back to itself within a year, you still don't have to put up with those symptoms, and there's things that you can do besides just the medication or putting up with it.
Yeah, absolutely. And I think, as you mentioned earlier, that anything in the postpartum phase tends to be dismissed as just general exhaustion, fatigue, depletion. But there can be, I guess, for women to remember that there can be more, not more serious concerns, but just more underlying concerns there that are worth investigating if you're feeling, quite awful. And I know for me, when I was diagnosed with postnatal depression, on my own journey of what we're doing with Askle, and our leading practitioner, Miranda Miles, or our medical advisor, Miranda Miles, she talks a lot about the misdiagnosis of postnatal depression and actually often being postpartum thyroiditis. Is that something that you...
Yeah, it happens all the time. And this is the thing. And I guess in your postpartum period, you're very vulnerable as well. And again, it's really hard to keep on fighting for the answers, and that's often what it is. It is a fight to get those answers. And as I said, unless that TSH is falling out of that very large reference range, you're going to be told that it is just normal. And this is because you've had a baby. And, I unfortunately see it all the time in clinic where women are just told, well, it's because you've got a baby or you've got toddlers or, you're going to feel like this forever. And they're not actually even being tested, not even the TSH, which it has been sent away, which is just disgusting. And so I guess this is where taking it into your own hands and using a blood pathology provider that doesn't necessarily need a GP. The only thing is you're going to need to be able to get those bloods read for you through somebody. So, but yeah, I definitely recommend just going about it yourself because far too much is missed in the postpartum period. And if we think about the thyroid, nutrient deficiencies are also a really big player. So we've talked about the hormonal imbalances that happen, but in pregnancy, we know that nutrient depletion is huge. So baby is storing so much of certain nutrients, which actually are needed for optimal thyroid health. So if we think about the thyroid cofactors, we think about iron, vitamin D, vitamin B12, folate, vitamin A. These are all nutrients that are needed in abundance to support your thyroid health and that functioning of the T3, T4 hormones, which we spoke about. It's not uncommon in their iron. Some women may have an iron infusion, but it may not hold all that well, especially depending on what's happened with their birth and how long they've bled for and when they've got their period back, all of that. Vitamin B12, the reference range for a GP, I think is 138 or something like that. Like really, I like to see that in the 500s
Wow.
for pregnancy. Yeah, it's a real... Isn't it? And then vitamin D is the other one where if you've got vitamin D of 50 and above, you're told that your vitamin D is okay. But again, we're really wanting to see that at 80 or above, even 100 to be in that optimal level. So, I mean, there is a big difference in what we're looking for, and nothing against GPs. We need to remember that a GP, the general practitioner, they know a little bit about a lot. So this is where going to see someone that is a specialist in a particular field is really worthwhile, because when we look at blood tests, we're looking at that for you as an individual, whether you be pregnant, postpartum, preconception, wherever you are in your journey. We're looking at general reference range for a 50-year-old male, an 80-year-old male, a pregnant woman, an 18-year-old female. because that's what the reference ranges are, population.
Was it even like male, female when they talk about ranges? It's literally just like the general
population.
Which just blows my mind. And I guess what you're talking to is what we do at Askle as well, in that individualized, personalized nature of healthcare for women. You also mentioned menopause. So is menopause a time, or even perimenopause, when we start to see thyroid issues coming about?
Yeah, for sure. And again, that's that hormonal shift. So if it hasn't occurred earlier through pregnancy and or postpartum, assume that you've been through that, then it'll be menopause, maybe the next time, and that's that hormonal shift that's occurring.
And so interesting, because it's just another phase in life where a lot of women's concerns are dismissed, in that, oh, you're just, like, I think perimenopause and menopause hasn't been given the light of day. I would say, feel like if your GP is dismissing you as, emotional or just whatever, or just it's just a hot flush, or they might say, oh, you're just going through menopause, like actually investigate it and look into what could be going on beyond the surface. I feel like we could talk forever, and I really want to make sure we actually get into like some tips and tricks around lifestyle and supplementation, because diet and lifestyle are always going to be number one. We say that here at Askle, even though we provide supplements, your diet and lifestyle. But then there is our diet, everything they need to be consuming. Our soil tends to be nutrient depleted, like all these sort of different reasons as to why we're possibly not getting everything we need. So that's where we would bring in supplementation. But yeah, I'd love you to talk about how we can incorporate different lifestyle supplement factors that.
Yep. So a big one with the thyroid is inflammation. So gluten-free is a great starting place, and research has shown that within 3 months, your antibodies will start to go down, assuming you have antibodies. So gluten-free is my absolute non-negotiable. It's very easy to go gluten-free these days. Just obviously be checking your packets and making sure that you're not on like the unhealthy gluten-free diet, and you're sticking to more whole foods and I guess gluten-free products. So gluten-free is a big one. That's obviously going to decrease, which ties into this as well. For some, and not everyone that I will do this to, but if there is the kind of like IBS, SIBO picture or leaky gut picture, dairy could be another inflammatory marker for you. And for a period of time, you may want to also look at removing dairy, especially if you're noticing issues after time, but it doesn't mean that it won't be long term. And then other just kind of like general rules. So if you're in the hypothyroidism camp, so for your cooked foods, easy to digest foods is really what we're looking for. So we're trying to take the burden off our digestive system. So that would be lots of slow cooked meals, opt in for your minced meat instead of maybe sitting down to like a full steak, unless you're chewing that really well. Your cruciferous vegetables, which are things like your broccoli, cauliflower, Brussels sprouts, those kind of vegetables, we're really wanting to be cooked because they can block the absorption of iodine, and iodine is a really essential nutrient for thyroid health, especially in hypothyroidism clients. And again, with your iodine, it's not something that I would supplement with unless we tested through a urinary test with ice cream, but you can certainly add that into your diet. The easiest way that I do it is the seaweed flakes. So they kind of look like fish food. I often use like the dulce flakes and things like that, and you just sprinkle that onto your meals, and it's really easy. You can't taste it, but yeah, a really good. What else from a dietary point of view? Looking at your minerals, so and your micronutrients, getting your Brazil nuts in. So 4 Brazil nuts a day, selenium dose that you need for your thyroid health as well. Getting out in the sun, making sure that your vitamin D is propped up. Again, really important. in
Right.
vitamin D. So making sure that when you are out in the sun, you're not hopping in the shower afterwards and washing off that transdermal vitamin D. You're actually allowing that 30 minutes for it to absorb.
I did not know
But
that.
yeah, those yeah, you can actually wash vitamin D off. So again, if you think about, in here in Australia, you'll go down the beach, you'll be sitting at the beach, sunbaking, and then you hop in the water, and we're literally just like washing that off unless you've allowed for at least 30 minutes for it to be absorbed into the skin.
Wow.
So here you go.
Yeah, there you go. Okay, that's a good little tidbit for everyone. I did read somewhere, because I always wear sunscreen, but that you should try and just have at least 10 minutes I was going to say sunscreen, of sun on your face to just absorb the vitamin D. And then you can wear your sunscreen and do all that kind of thing. So that's something I've tried to incorporate a bit of.
Yeah, so I always wear sunscreen on my face because anti-aging over here.
Yes.
But your vitamin D is actually most absorbed in your fattier parts. So trying to roll your pants up or your shorts up and let your thighs out, your butt out, if you can
I was
like
going to say,
lay
so
on
just
your deck. Yeah,
take your bum out.
exactly. Even through a window though, like just
Yeah.
sitting there in your knickers, having your morning coffee and letting the sun come through the window. It's the fattier parts of your body that will actually absorb the most vitamin D. So
Wow.
yeah, there you go.
There you go.
Thing.
Okay. So that's diet. Lifestyle, I imagine reducing stress is a huge one, which we need to do for every kind of condition.
Yeah, absolutely. And then we also needed, when we talked about those three kind of pillars, I guess, and one of them was like the trauma/stress, in that's also environmental chemicals and things like that as well. So if you have, a large chemical burden, so we think about certain careers like painters. I know where I'm from, there's literally like a chemical plant where they make bombs, like and yeah, it's wild, but you can imagine like the chemicals that those women are exposed to on a daily basis, like being on the site, right? So think about, chemicals, trying to lessen that load within your house. So I always say, just as you run out of things, just try to go for like the greener version of that, and less chemicals. I can't remember the statistics, but it's like over 300 chemicals I think a woman puts on her body a day. So really just starting to look for the natural products when it comes to like your makeup, your body wash, your perfumes, like all of that kind of stuff as well is really important, and will help lessen that load from a lifestyle point of view. But yes, stress, I like to think of stress as, like obviously you've got that mental load, but then we also need to think about it from a physical point of view. So I too am a Hashimoto's gal over here, but was diagnosed when I was 24. And when I'm in like a flare, I call it, because I wouldn't say that I have Hashimoto's all of the time, but when I'm in a flare, things like HIIT training, running, those are not my friend, because it's adding just extra stress on my body. And our body, even with exercise, cannot perceive the difference between a good and a bad stress. So yes, exercise gives us a whole lot of mental clarity and, all the rest of it, but it's still a stress on our body. So I guess when you are in a flare, even look at your exercise and what you're doing. So, your slower things, again, is what you're going to be looking for. Your yoga, your stretching, your daily walks, they're going to be what is best for you whilst in a flare, as opposed to your high intensity.
That's really good pointers, especially around your body not knowing what's a good and bad stress, what's eustress and distress. Okay, I'm conscious of the time, but I do want to say, and then so supplementation, should people be trying to create your own concoction and say, well, you just mentioned B12, you mentioned, so I'll go to Chemist Warehouse and grab what I need, or what are your thoughts on supplementation?
No, definitely not. But supplements, there is a place for them, particularly in those initial months to balance your thyroid. So again, Askle is fabulous because it is a concoction, what I would generally put together for somebody in a clinical setting. And so something like your product, you will be able to get it all in that one scoop per day, which is really beneficial. We're looking at things like your aloe vera juice, selenium, myonisitol. Those three products on their own have beautiful research and very strong research around lowering your antibodies within a 3-month period. We would obviously be looking at other nutrient depletions, because we've talked about those nutrient cofactors, which are really important. So like your B12, vitamin D, those kind of things. And then I guess it depends on where your blood sits. So if you've got a really high T4 reading, for example, something like creatine can be what brings that back into balance. But it really is just trying to find the right balance between your supplements, because your thyroid, it's fragile. And if you throw the wrong supplement into the mix, then it could spiral out your TSH or T3, for example, or T4. And it's not uncommon, especially in those early diagnosis days, for your thyroid to swing from hyper to hypo to hyper, and it just keeps going back and forth until normally it sits in that hypo category. I think for hyper, it's 1 in 1,000 actually have hyperthyroidism, as opposed to 3 to 4% of the population have hypothyroidism. So more often than not, that's where you'll end up swinging. But in those early days where you're swinging between the two, you don't want to be just playing around with any supplement, because you can really throw your thyroid out, especially with things like iodine. It's a big one.
Yeah. So definitely having a practitioner walk you through it, make sure that they're doing the prescribing for you, don't self-prescribe, and have someone that can support you through the whole process.
Yeah, for sure.
Yeah.
But start with your diet and lifestyle, because that's in your control. And that also will give you really big bang for your buck. And it's hard because at the start, when you're feeling tired and exhausted and you're constipated and you're not pooing out your toxins and, like just all of that, it's really hard to start making change. And I guess from a lifestyle, diet, holistic perspective, whenever we're looking at the food is medicine approach, like it's a slower burn. So it can take months to really start reaping the benefits, but I promise you it will happen. You just got to stick at it for a few months and just push through those really hard times.
I think anything that's a slow burn is what is actually sustainable. Anything that's quick, it's not going to work long term. So always commit to, a journey.
That's it. And just to wrap it up, Steph, like I was diagnosed when I'm 24, I'm 38 next month, and I've managed my thyroid for however many years, far too long, 14 years, through diet and lifestyle that whole time. And I, as I said, I have flares. So if I've got a really stressful period, or pregnancy, for example, has flared up my thyroid in the past, but I now know how to manage it. I know what symptoms to look for. And I've never had to fall back on medication to get me over the line. I just know what I need to do. So yeah, stick it out, because it is well worth it. And as I said, for the most part, 90% of the time I would live in full remission with no thyroid condition. So yeah.
Yeah. What a positive story then for everyone to know. Well, thank you so much, Shelley. And sorry, we're a few minutes over, but that was, incredibly educational. I think everyone will have gained a lot from that. What will happen is we will have this recording on our website. We'll also have a blog that we'll work with Shelley on that will be on our website with resources and links and things like that. So all of this information will be available on askle.co. But thank you again, Shelley, and thank you everyone for joining, and we'll see you all soon.
Bye. Thanks for coming.
Thanks.